Welcome, aspiring nurses. Today, we embark on a journey to understand the cardiovascular system, the lifeline of our patients. Our focus today lies in understanding the core components of this vital system: the heart, the blood vessels, and the blood itself. So let's dive in and equip ourselves with the knowledge and confidence to become exceptional healthcare providers. As healthcare professionals, understanding the cardiovascular system is your ally in patient care. It's responsible for the continuous flow of blood, ensuring oxygen and nutrients reach their destinations, while waste products are efficiently removed. This intricate system plays a crucial role in regulating blood pressure, maintaining body temperature, and fighting off infections. At the heart of the cardiovascular system lies the heart, a muscular organ about the size of your fist. The left ventricle, with its thicker muscular wall, faces the tougher task of pumping blood to the entire body. Understanding its structure and function is fundamental for any aspiring nurse. Imagine the heart as a meticulously designed house, with 4 rooms specifically designed to manage the flow of blood. The right ventricle pumps deoxygenated blood to the lungs for oxygenation, while the left ventricle pumps oxygenated blood to the entire body. This synchronized dance ensures a constant flow of blood, maintaining the body's delicate equilibrium. Valves act as gatekeepers, ensuring the smooth, unidirectional flow of blood. These valves open and close in perfect timing with the heart's contractions, preventing any backflow. The rhythmic opening and closing of the heart valves produce the characteristic lub-dub sounds we hear through a stethoscope. The heart occupies a strategic position in the chest, nestled slightly to the left of the center. This location provides optimal protection and allows for efficient blood distribution throughout the body. Its proximity to major blood vessels ensures a streamlined flow of blood, optimizing the delivery of oxygen and nutrients. The left ventricle stands out as the true powerhouse responsible for pumping oxygen-rich blood throughout the entire body. This task requires immense force and endurance, explaining the left ventricle's more muscular composition. Understanding the left ventricle's unique role is crucial for nurses, as it provides insights into a range of cardiovascular conditions. The cardiovascular system is a non-stop dance of blood circulation, ensuring every cell receives the oxygen and nutrients it needs. Arteries carry oxygen-rich blood away from the heart, while veins return deoxygenated blood back to the heart. Capillaries, tiny vessels, act as the bridges between arteries and veins, facilitating the exchange of oxygen, nutrients, and waste products. Central to the cardiovascular system's function is its role in oxygen transport. This journey begins in the lungs, where oxygen diffuses into the surrounding capillaries. This efficient delivery system ensures that every cell receives a constant supply of oxygen, sustaining life. The cardiovascular system also removes metabolic waste, ensuring a balanced internal environment. Waste products diffuse from the cells into the capillaries, returning to the heart via the venous system. From there, it's pumped to the lungs for expulsion and filtered by organs like the kidneys and liver. The heart beats rhythmically, producing the familiar lub-dub sounds. The lub sound occurs when the tricuspid and mitral valves close, while the dub sound happens when the pulmonary and aortic valves close. These sounds provide valuable information about the heart's health, highlighting the importance of auscultation. Checking a pulse provides a window into the heart's activity. Each pulse represents a heartbeat, a surge of blood ejected from the heart. As you progress in your nursing careers, you'll master the art of pulse checks, recognizing variations that could signal underlying health conditions. Section 2. Decoding the numbers normal and abnormal heart rates. Understanding the significance of heart rate readings is crucial for nurses, as it provides valuable insights into a patient's cardiovascular health. A normal resting heart rate, typically between 60 and 100 beats per minute, indicates the heart is efficiently pumping blood throughout the body. However, deviations from this normal range, whether too slow or too fast, can signal underlying medical conditions and require further investigation. A heart rate below 60 beats per minute, known as bradycardia, could indicate problems with the heart's electrical conduction system or other underlying health issues. On the other hand, a heart rate above 100 beats per minute, known as tachycardia, could be a normal response to exercise or stress, but it could also indicate conditions like fever, dehydration, or heart rhythm disorders. As nurses, you'll learn to interpret heart rate readings in the context of a patient's overall clinical picture, considering factors like age, medical history, and current medications to determine the significance of any abnormalities and guide appropriate interventions. Section 3. Blood pressure, the pressure of life. Blood pressure, a fundamental physiological parameter, reflects the force exerted by blood against the walls of arteries as it circulates throughout the body. This pressure, a vital sign we measure routinely, provides crucial information about the heart's workload and the health of our blood vessels. Imagine the circulatory system as a network of pipes, and blood as the fluid flowing through them. Blood pressure represents the pressure within those pipes, influenced by the force of the heart's contractions and the resistance encountered in the blood vessels. To measure blood pressure, we use a device called a sphygmomanometer, commonly known as a blood pressure cuff. This inflatable cuff, wrapped around the upper arm, temporarily compresses the brachial artery, stopping blood flow. As the cuff deflates slowly, we listen with a stethoscope for the sounds of blood flow returning to the artery, providing us with two key readings: systolic and diastolic pressure. Understanding these blood pressure readings is essential for nurses, as they provide valuable information about cardiovascular health and guide clinical decision-making. Systolic versus diastolic. Understanding the numbers. Blood pressure has two key readings: systolic and diastolic in mmHg. Systolic is the maximum pressure during heart contraction. Diastolic is the minimum pressure when the heart rests. Normal is around 120/80 mmHg, but it varies. Hypertension increases risks of heart disease and stroke. Arteries, the highways of life. Imagine a bustling highway system transporting essential goods. That's the role of arteries, carrying oxygen-rich blood from the heart to every cell. These vessels withstand the force of each heartbeat. Unlike veins, arteries handle the surge of blood from the heart. Their walls have three layers: a smooth inner lining, a thick middle layer of muscle and elastic fibers, and a tough outer layer. This composition provides strength and flexibility. Arteries adjust diameter to regulate blood flow. They are crucial for maintaining the body's equilibrium. Section 2. Veins, the return journey. While arteries are responsible for the outward journey of oxygen-rich blood, veins play a crucial role in the return trip, carrying deoxygenated blood back to the heart for replenishment. This return journey, however, presents a unique challenge: gravity. Unlike arteries, which benefit from the heart's pumping force, veins rely on a different mechanism to overcome the downward pull of gravity. Veins, with their thinner walls and larger diameters compared to arteries, are equipped with a secret weapon: valves. These one-way valves, strategically positioned along the length of veins, act like gates, ensuring blood flows in one direction only, towards the heart. As blood moves through the veins, these valves open, allowing passage. When blood flow slows or attempts to reverse direction, the valves snap shut, preventing backflow and maintaining the upward movement of blood against gravity. This ingenious system ensures that even against the pull of gravity, deoxygenated blood is efficiently returned to the heart, where it can be pumped to the lungs for oxygenation and begin its journey anew. The rhythmic contractions of surrounding muscles also assist in propelling blood through the veins, further facilitating this essential return journey. Section 3. Capillaries, where the magic happens. Capillaries form a vast network connecting arteries and veins. Blood vessels become so small that red blood cells pass through single file. Capillaries, with their thin walls, allow the exchange of gases, nutrients, and waste. Oxygen and nutrients diffuse into tissues, nourishing cells. Waste products move into capillaries for removal. Capillaries play a monumental role in sustaining life. Section 1. Circulation Pathways, a tale of two loops. The cardiovascular system, far from being a simple loop, is a complex network of interconnected pathways, each with a distinct role in maintaining the body's delicate equilibrium. Imagine two interconnected loops working in perfect harmony to ensure the continuous flow of blood and the efficient delivery of oxygen and nutrients to every cell. These two loops, known as the pulmonary and systemic circuits, represent the heart's dual role in maintaining life. The pulmonary circuit, a shorter loop focused on the lungs, is responsible for replenishing the blood's oxygen supply and removing carbon dioxide, the waste product of cellular respiration. The systemic circuit, on the other hand, is a much larger loop, encompassing the entire body. It's responsible for delivering oxygen-rich blood and essential nutrients to all tissues and organs, while simultaneously collecting metabolic waste products for removal. These two circuits, though distinct in their functions, are inextricably linked, working in concert to maintain the body's internal balance and support life. Understanding the unique roles of these circulatory pathways is crucial for nurses, providing insights into a wide range of cardiovascular conditions and their impact on overall health. Section 2. The pulmonary circuit, oxygen's refreshing breath. Imagine the pulmonary circuit as a breath of fresh air, where blood sheds carbon dioxide and takes on oxygen. This loop, involving the heart and lungs, maintains the body's oxygen levels. It starts in the right ventricle, pumping deoxygenated blood to the lungs. Blood travels through pulmonary arteries, the only arteries carrying deoxygenated blood. These arteries lead to capillaries around alveoli, where gas exchange occurs. Oxygen diffuses into capillaries, binding to hemoglobin, while carbon dioxide moves into alveoli to be exhaled. Oxygenated blood returns to the heart's left atrium via pulmonary veins, ready for systemic circulation. Section 3. The systemic circuit, delivering life to every corner. Imagine a vast network of roads connecting a bustling city to its countryside. That's the systemic circulation, a web of blood vessels extending from the heart to every corner of the body. Originating in the heart's left ventricle, it delivers oxygen-rich blood to the body. The aorta branches into smaller arteries, delivering blood to specific regions. Arteries narrow into capillaries where oxygen and nutrients are exchanged. Deoxygenated blood returns to the heart via the venous system. Valves in veins ensure unidirectional flow, aiding blood's return journey. Section 1. The heart of the matter, a recap. And there you have it, future nurses. We've journeyed through the cardiovascular system, exploring its ability to transport blood. The heart pumps oxygen and nutrients to cells, removing waste. Its four chambers work in harmony to receive and pump blood. Atria receive blood, ventricles propel it into circulation. Valves ensure smooth one-way blood flow. Section 2. Masterful Assessment, your nursing toolkit. As future nurses, your understanding of the cardiovascular system extends far beyond textbooks and diagrams. It's about applying this knowledge in real-world clinical settings, using your skills to assess, monitor, and care for patients with a wide range of cardiovascular needs. Remember those key nursing assessments we discussed? Mastering these techniques is paramount in your journey to becoming skilled healthcare providers. Pulse checks, those seemingly simple assessments, provide valuable information about a patient's heart rate and rhythm, offering clues about their overall cardiovascular health. Blood pressure measurements, another cornerstone of cardiovascular assessment, provide insights into the force exerted by blood against the walls of arteries. By understanding the significance of systolic and diastolic pressures, you can identify potential risks and guide appropriate interventions to maintain healthy blood pressure levels. And let's not forget the importance of auscultation, using your stethoscope to listen to the heart's rhythmic lub-dub. This skill allows you to detect subtle variations in heart sounds, providing clues about valve function and overall cardiac health. Section 3. Lifelong learning, the beat goes on. As you embark on your nursing careers, remember that learning about the cardiovascular system is an ongoing journey, a continuous exploration of this fascinating and vital system. The knowledge and skills you gain today will serve as a solid foundation, but the pursuit of deeper understanding never truly ends. Embrace every opportunity to expand your knowledge, whether through continuing education courses, clinical experiences, or engaging with the latest research and advancements in cardiovascular care. The field of medicine is constantly evolving, and your commitment to lifelong learning will ensure you remain at the forefront of providing the best possible care to your patients. As you move forward, remember that every patient encounter is an opportunity to apply your knowledge, refine your skills, and deepen your understanding of the cardiovascular system. Embrace these challenges with enthusiasm and compassion, knowing that your dedication to mastering this vital system has the power to make a real difference in the lives of your patients.